Doctors of Reddit, what was your "this person is obviously freaking lying" faking moment? I've tested the hearing of a few kids, like 10-12 years old, pretending to be deaf in one ear. All you do is turn on your microphone and talk in the deaf ear at a quiet level and ask them a question about something they care about. Like young boys, for example, always fall for it when you ask them what video games do you play at 20 decibels. Works every time. This is off topic, but a bartender once told me that if someone looked underage trying to buy alcohol, he'd ask to look at their hands and say, "Nah, you're not 18 inches. All the actual minors would be wide-eyed and incredulous and ask how he knew just from looking at their hands. All the 18 plus would call him out on it. Mzir had a patient start seizing in front of the cops after they were pulled over for possible drunk driving. We get there and patient is still on and off seizing. We get them on the stretcher and in the back of the ambulance. Surprisingly, the cop joins us. As I take their arm, the shakes start up again. So I tell them, "Yo, if you want this medication, I need you to stop so I can start and dive real quick." Patient stops to let me start the line, and once I say I'm done, they start back up. Not a doctor, but a hearing aid dispenser in private practice. Had a patient come in for a hearing test, young guy in his mid-20s, which is already unusual. Main issue is that he's getting noise complaints about his music. No issues with his ears physically, so I do the hearing test, basically ends up with a profound hearing loss. Weird because that's basically sign language territory there. I walk behind him and ask him what his plans are for the evening, to which he responds appropriately. Definitely what we call a non-organic hearing loss. He was trying to get the results he wanted to justify being a dong of a neighbor. Well, that is both clever and profoundly douche-why. I hope you prescribed extra silent music as to preserve whatever's left of your sensitive hearing. I had an employee tell me their spine couldn't stay straight and when they tried to sit up they'd flop to the left or right. Followed that up with telling me they found out that this was due to one of their lungs being deflated. You know, because your lungs hold your spine straight. A highlight of my career when he finally quit because he just wasn't about that cubicle life. Yeah, you would have more than a bad posture with a pneumothorax. So my mom is a doctor. She told me this story of a woman who came in and said she had been having seizures and as a result she couldn't move her arms. So my mom tested her arms and tried to push it and see if she would react. The woman kept resisting and trying to keep her arm in place since she couldn't move it. My mom had to control herself from laughing and told the woman that she needed to relax. She then left the room and discharged the patient. Patient comes in saying she has terrible abdominal pain 10/10. I say okay, and start to examine her. She immediately starts screaming the moment I touch her belly. But look, I've seen patients in terrible pain, and nobody has ever yelled in pain with their eyes open. She wasn't even tensing or anything. It was a really sad case though. She has a history of coming and saying she was pregnant when the urine and blood test was clearly negative. In one case she even tried to steal a pregnant patient's urine. She got caught pretty fast. She was on psych follow-up. Not sure what the diagnosis was, but my guess would have been Munchausen's. Anyway, we sent her home without pain meds. My second patient was a man with a chronic cough. Asked him, "Are you smoking?" and he says no, examines him and there's a cigarette pack right in his breast pocket. A doctor had the worst person in the world with fake seizures that could only be cured by Dialysis, the most potent opioid that can be administered in the hospital IV. Usually, seizures aren't treated by opiates. This lady was insufferable and she knew all the rules. She would make sure her enabling husband, IQ 50, came in so she had a driver so she could get knocks. If we didn't give knocks he would shut that place down screaming and threatening. She would spy the parking lot to see which doctors were working BC Dialysis. Well, one day I freaking had it. She had brought her son, IQ normal, to the he had a learner's permit. She reassured me, and she started fake seizing and screaming. I just let her go. Then she got threatening so I called security and I was the first person to ever get her removed. She then proceeds to walk out the doors with her son and not 15 minutes later she is back in the air as a trauma. Full collar and all. She says she's gonna sue me, that she went outside, had a seizure, fell and is in more pain. Dialysis. So I stop her right there and walk to security around the corner and look at the security tape. She very clearly looked around, made sure no one was looking, then gently laid down in a mangled position. In the video it looked like her son said frick this and he literally walks away and walks several miles home. I went and cleared her from her C-collar and backboard after calling police. They came and didn't do anything. She was back 2 days later. This is a great story. Doc, do you need to refill your meds? PT. Nope. Still taking them. I am asking because I know based off of my prescription that it is time for you to get more. If you don't need more it means you aren't taking them. I love the I don't need a refill. But based on the last time it was filled you should have run out 2 months ago if you were taking it correctly. Not an MD, but heard this from my physician friend. Known malingerer comes into the claiming to be paralyzed on one side of her body and demanding stroke meds. My friend examines the malingerer and asks, "Hey, how did you get that bruise under your arm?" Malingerer lifts up her paralyzed arm to look for the non-existent bruise. My friend is very clever. That's the first time I've seen malingerer used in the wild. I learned that word in the 7th grade and it always stuck with me. Patient came in with seizures, non-specific weakness, lightheadedness, and numbness tingling in her hands and feet. She gets admitted because of some electrolyte issues, not related to the neuro symptoms. These were corrected later and symptoms persisted. Sure enough, on the 2nd day she seizes. As soon as the diazepam is pushed, before the flush is even in, she stops seizing. This happens again 3 hours later. The 3rd time while she was seizing we took her hand and tried to drop it on her face twice. Both times she moved her hand out of the way so it wouldn't smack herself in the face. We just stood there until she got tired of shaking. It took about 5 minutes. She left AMA a few hours later. I feel like it must be hard to fake a seizure. I've seen a couple, and I'm just not sure how you would convincingly replicate that. Had a patient flop around like a fish out of water in my waiting room while shouting I'm having a seizure. People faking seizures is actually fairly common. Smack 'em with some ammonia salts and suddenly they're fine. God damn it, get the ice rod. We got a live one. Funniest story of my medical school career. We were rounding on the wards for a teenage son whose parents were in the room. Dad, UHH. We saw our son tested positive for marijuana. This is clearly incorrect. Attending. There are some false positives but the test is pretty accurate. Dad, my son is a lifeguard. He would never smoke. Son, yeah, I've never ever smoked. Looking scared AF. Attending. We can order a more sensitive test that will give a more accurate answer. Son, well, I do sit really high up on the lifeguard chair and I think some of the kids around the pool smoke. So maybe I breathed in some of the smoke while working. Team. Frantically ends conversation to leave the room and laugh hysterically. That's second-hand stuff. It can really get to you. An ex of mine told me a story about a dude that had a window wiper handle stuck up his butt because he had one laying in the shower, slipped and fell onto it. It never occurred to her that it might have not been an accident. A nurse, not doctor, and not exactly faking it, but had an unconscious woman brought it by paramedics with blood alcohol level well over 0.2. She'd been found passed out on the floor by the parents of the toddler she had been hired to watch. They were terribly worried about her, so the staff explained that she was unconscious because of her high blood alcohol level. They asked, completely seriously, what would cause that because she doesn't drink. This one girl kept saying she didn't do any M or hallucinogens, but said people would look evil, and that she couldn't watch TV or listen to music. She was admitted for suicide attempt and stayed in her room almost all day. More than a month goes by and I met her. Negative CT. Drug screen negative all month. Plus marijuana on admission. I asked what her evil visions looked like and she really struggled but said something that triggered my memory. Said that teeth looked big and sharp. I asked a bunch of questions and she said that people looked much closer than they actually were, or moved much faster or slower than they should. Had a pretty significant migraine history. It seemed like they had photo and phonophobia, nausea, and scintillation scotoma and fortification spectra as some of her evil spirits. Her super high dose antipsychotics were stopped. Lower epilepsy threshold trigger migraines, and she was started on Topamax and escitalopram. After 2 weeks symptoms resolved. Diagnosis: Alice in Wonderland syndrome as or of migraines induced by antipsychotics in a suicidal teen with depression and psychotic features. Moral: Sometimes they are just telling the truth the best they know how. That's super interesting. Sounds like it could easily be misdiagnosed about 100 ways. Vet student here. Used to work as a technician near a major university as I went through undergrad before getting accepted into vet school. The amount of animals, mainly dogs, who would come in with college students on the weekends after ingesting drugs or alcohol the students left out is higher than I would have expected. But the owners won't tell us the animal got into a drug stash because they don't want to get in trouble, even though we know that's what happened because of the side effects the dog is experiencing. But we need the confirmation from the owner. Just tell us. Making up a story or saying something else happened isn't helping you or your pet, especially in life-threatening situations. In order to properly treat the drug toxicity, we need to know what it is. I promise you, we aren't interested in getting you in trouble. We're interested in saving your pet. Help us do so and be honest when you visit the doc or vet. My dog tripped and fell into a pile of drugs. PA not a doctor, and I have a couple, but when I was on my clinical rotations, one of the funny things I remember was on my rotation, a lady was complaining of some vague, generalized pain. Had a feeling she was malingering. I started a neuro exam and was testing her cranial nerves. Asked her to keep her head still and follow my pen. She was clearly focusing on the wall behind me and not tracking my movements. I said again, no, follow the pen, with your eyes. She said over and over that she can't and that she's really trying and this must be really bad. So I moved on to another exam and while talking with her and holding her attention, I walked around her bed from one side to the other. She tracked me with her eyes the whole time. It was the same rotation we had someone feigning seizures in order to get Ativan. Might have been the same lady on a separate occasion, now that I think of it. Also, although a single patient doesn't stick out, one of my favorite tests if you have a high index of suspicion someone is lying about upper extremity paralysis, is to hold their arm over their face and just drop it. Anyone who isn't paralyzed will subconsciously move their arm so they won't hit themselves in the face. I'm a medical assistant. Had this teenage girl, probably 16, come in saying that her wrist was broken. Her mom was behind her rolling her eyes after every time she would tell me how bad it hurt. She then proceeded to flop it in an attempt to show me how bad it hurt when she did that. She said it was clearly broken and she would need a cast. I said I would take her back and let the doctor do some x-rays and do their thing. The mother asked to talk to me outside of the room and she told me her daughter's friend recently got a cast and her daughter was notorious for being overly jealous. I just responded by saying that if there were anything wrong, it would show up in the x-ray. Guess what? She didn't get a cast and threw a fit. Last I saw her was her crying and throwing a temper tantrum outside of the waiting room and being dragged out by her very embarrassed mom. At least the mom wasn't delusional. I see a lot of pain, drugs, and pseudo seizures in this thread. Since I'm in internal medicine, I saw a patient recently who was like, yeah, doc, I take my insulin every day. HbA1c was higher than the lab could measure. The report just says 17%. This dude's blood is basically syrup. For your information, diabetes is diagnosed with an A1C of 6.5%. Bad as anything, 8%. I once had a patient with an A1C of 13% and at her follow-up appointment with a neurologist after her stroke he wrote in his note the highest A1C I have ever seen and I was like LOL. I have another patient who told me that he really needed a prescription for marijuana because when he was actively using it his blood sugars were under control. Under control with a HbA1c of 14%. Edit. A lot of people have trouble affording their meds and I am very aware that this results in non-adherence. If you are having trouble affording your meds, let your doctor know. There are $4 lists at Target, Walmart, and some grocery chains. GoodRx is also a tool to help people find affordable meds. Some of my greatest, it sometimes feels personal victories have been getting people from poorly controlled blood pressure and diabetes to well controlled because of these simple tools. A friend of mine was a counselor. She was assigned a tough case, a patient who presented as an alcoholic, but who insisted up and down to every doctor counselor he sat down in front of that he only had one drink a day. I can't remember, vodka, maybe. He never wavered in that, 1 drink a day, but he had a lot of the symptoms, life problems of an alcoholic. My friend was the first one to ask, "How big is your 1 drink?" He admitted it was a flower vase. I expected a larger than average container, but flower vase caught me off guard. Also, it's unfortunate that he wasn't drinking bud. Not a doctor, but I am a patient who lied. Before my sobriety I did some doctor shopping. After that got hip I'd have to go around to urgent cares and stuff. I ended up needing something badly, so went to my GP. I've been going to him for years, like since I was 18. I told him I was sober and had tooth pain and back pain and other pains and had tried everything against what he was supposed to do. He looked me dead in the eyes and said, "Both of us know what you're saying right now is complete horseshit." Turns out my doctor was in AA. I ended up leaving after crying for 30 minutes. Got sober within the next 6 months. He goes to my home group and is still my doctor. As someone in sobriety and the medical field, I love your doctor so much. I'm a therapist, but I do diagnosing if that counts. I had a woman in my office claiming she had multiple personalities. Did is kind of a sticky diagnosis to begin with, but that's she was claiming that she could talk to different personalities and then bring them out if she needed to. All of this seemed like it could potentially be more of a psychotic disorder or attention seeking. Then she introduced me to her girlfriend who also had multiple personalities, which they started naming, most of which were based on candy or Disney princesses. Notably the bad one was called the Beast. Sounds like someone watched Split and took it too seriously. I'm a dentist. We have a drug tracking program shared with any narcotic prescriber that tells me what patients have filled out what. I just need their name and DOB. I get drug seekers every now and then with real or fake pain claiming they haven't been taking anything. Quick search shows me the truth. Most people don't know I can do this. Liar, liar, pants on fire. M's here. I had a patient who was pretending to suddenly be paralyzed. Very dramatic. On the floor, saying she couldn't feel anything below her neck. After assessing her, we had her stand and get onto the stretcher, which she did without difficulty, despite being totally paralyzed. In the ambulance, she told me how she sometimes goes code blue, and how if she goes code blue, I must not rub her chest or cause her pain. The best way to revive her was to turn the lights low and talk softly and soothingly to her. She told me all about how she went code blue in the hospital over a dozen times last time she was admitted, and how the doctors were so scared they almost couldn't revive her. During transport, I asked her for her birth date. Her eyes fluttered shut and she didn't respond. We drove in silence for several minutes while I worked on documenting the very detailed and unrealistic history story she had been telling me. Eventually her eyes fluttered open and her hand went to her chest. She says, "Oh, I think I went code blue there for a minute." I replied, "Nope. No worries, you didn't. You're totally fine and your vitals were pristine. You don't have to worry, you're safe. So what's your birth date?" She looked super annoyed. OMG, I had a regular like this years ago. She'd pretend to be unconscious a lot. One shift my partner decided to test her dedication and held her hand above her face then let go. When her hand fell to the side of her head he just looked at me and said, "Yup, she's faking it." I've never seen a more angry looking unconscious person. I was getting the rundown on a patient once and the nurse said something about back pain and C4. Okay, he has some injury to his neck and it hurts. Nothing special. Then I talked to the guy and nope. He claimed someone had wired the explosive C4 into his back and 1. It hurt. 2. He was afraid it would explode. I don't know why he thought lying about explosives in his spine would be more believable than saying he was moving a couch or something, but whatever. This is about a time when a patient fooled me. Guy came into the ED with a hand infection from shooting him. During my history taking interview he denied ever having surgery before, but on the abdominal exam he had an obvious large abdominal surgery scar. When I asked him about it, he said he had surgery for liver cancer but couldn't afford his follow-up care. Now, I was an intern I think, very junior in my training, and still not as jaded as I am now. So I was very concerned and asked him where he had been getting his cancer care so I could get the records and maybe try to get him an appointment in our system. He told me, signed a release, I faxed it over, and a little while later I received his records. No liver cancer. None. The scar? It was from an X-lap. Exploratory laparotomy. For example, opening up the abdomen to see what badness is inside. He needed the X-lap for something many of my colleagues may see coming. The removal of a rectally inserted shampoo bottle. That was one of the last times I took a patient's entire story at face value. Now I'm more of a trust, but verified type of person. Obligatory not a doctor post, but when I was a child I remember my doctor asking me about my diet and I as an overweight unhealthy child responded with the names of vegetables and fruits that we both knew I didn't eat. Doctor asked my oldest son what his favorite food was when he was 5 or 6. His answer was broccoli. We all knew he was lying. I love the classic I fell on it routine. 3-wick candle up the butt, fell in the shower, a 10 inches butcher knife in the gut, fell on it while making a sandwich, eggplant in the butt, definitely fell on it. Not a doctor but a worker in the medical field. Our patients come in 3 days a week for treatment, for about 4 hours at a time. One patient would always need to go to the bathroom about 4-5 times every time they were in the middle of treatment. To make a long story short, she wasn't using the restroom. She was doing H in the bathroom multiple times a day during her treatment, which would very quickly be dialyzed out of her system and withdrawals would set in. I always had suspicion that is what she was doing, but when she eventually died in the clinic and her reports came back positive for H is when we all knew for sure. Oh, I had a feeling it was dialysis when you mentioned the time frames. I'm a dialysis patient now, but literally in the process of getting a kidney, if all goes well. I lost 40 pounds in 2 months in a large part because I was so flared up in pain that I had no appetite. I went to the doctor, not for pain management because I have pretty much given up on that one, but because I was concerned about the rapid weight loss and some other health issues. My doctor told me I was lying about being in so much pain because I was losing weight, and if I was really in pain I would be gaining weight because when you are in pain you eat more because eating is a painkiller. I kinda wanted to hit his head with a hammer a bunch of time while shoving a cheeseburger in his face. You should see another doctor, get a second opinion. Unintentional weight loss is a huge red flag for us. We learn to fear this phrase in med school. Had this alcoholic patient who has been in and out of the hospital for so long because of his liver problems. Every time you talk to them about stopping to drink, he says, "I swear doc I stopped drinking." Keep telling him that's not what his health results look like, but still he keeps insisting. Can't call a patient a liar. So when he got better I discharged him and wrote specifically what amount types of alcohol in bold that he should stop. I had multiple paracentesis patients that would lie about drinking, eating salts, foods they weren't allowed to have, constantly. Once you're a regular patient we can pretty much predict how much fluid you're going to produce, so if it's increased we know it's because you're doing things you shouldn't. It's sad but you're right. Can't always call them out on it. 3-year-old having tonsil surgery. I run through my usual pre-op evaluation, history, and physical. Parents ensure that she hasn't had anything to eat or drink since the night before. Get her back to the OR, drift her off to sleep, and when I go to place the breathing tube, she vomits basically solid, completely undigested scrambled eggs and aspirates. Surgery is cancelled. We take her to the ICU. Parents obviously freaking fed her breakfast less right before they came in. Confront the parents and they basically say they thought we were just being too mean not letting her eat for 8 hours. There is a reason we ask you not to eat for a period of time before surgery. It is not because we just like being dongs. Listen to us, please. I had a child aspirate out instant noodles on me. When we did an emergency bronchoscope after securing the airway, we had to fish out bits of noodles from the lungs. It was horrible to oxygenate her. We confronted the parents and they fed her secretly in the bathroom 4 hours before the surgery because she was crying for food. EMT here. Had a dude who was unresponsive, still breathing, solid heartbeat. I dug my pen cap into his nail bed to see if pain stimuli would do anything, and nope. Then a fire guy did a good sternum rub, still nothing. So I said I'll get the catheter. I don't want him peeing all over you, my medic partner, in the ambulance. Won't get the lube though. He won't feel anything anyway. Oh, I'll also get you the largest needle we have so that you can start an IV. We have a surplus. Yeah, he woke up miraculously. Obligatory, not a doctor, but I do work in a hospital. One of the nurses was telling us about a patient that came into emergency reporting with severe headaches. When asked if he took any usual medication for them, he replied with Dilaudid usually works. Nurse was there thinking, MMHMM, right. Not a doctor, RN here. Back when I was a new nurse with less than a year's experience, I had a 20-YO patient admitted for a forearm abscess who, at change of shift, said she suddenly couldn't feel the left side of her body. Tested her by lightly poking each side, and yep, she can't feel a thing. Called a rapid response. The night shift IQ charge, who was very experienced, responded along with the day shift IQ charge. Well, the night shift IQ charge nurse took a pen and put more pressure than I had dead on the patient's toenail and watched her flinch and said, "You can feel that, can't you?" She turned to me and said, "This code is over, call the MD with results." Still had to take her to CT scan, which was perfectly normal, obviously, but I understood when the MD wanted to cover himself. When she started to complain of worsening pain because of the numbness, he laughed and said, "Give her Tylenol." We've all been caught out that way. Better than not believing in someone getting hurt that way. Not a doctor, but was the patient, and the doctor thought I was faking it. Came in with abdominal pain that I could also feel in my back. Hard to take deep breaths. We have genetic pneumothorax in the family. This was what was believed might be the problem. I am also quite tall. After pain meds everything was okay. Took x-ray of chest area, which came back negative of anything. This is when I noticed how the doctor changed his aim. Started to ask if I had been lonely lately, etc. I also heard the nurses talking about my case, calling me a pain med seeker. Went home an hour later, AMA. About a day later things went back to normal. I figured I had strained something. I had discomfort in that same spot on and off for about a year, but never went to check it out because of my previous experience. Then about 2 months ago, I was hit with the worst pain I have ever experienced. Same spot. I was throwing up, even when there was nothing to throw up. Blood taste in my mouth. Couldn't stand, couldn't lie down, nor sit. Any position was hurting. Called 911. Was told I should call a taxi because she didn't think it was an emergency. So, I did. When I got to the air, I was told to sit and wait. While waiting, I was sitting down and I had to swing back and forth with my upper body. This for some reason helped. It took about 1h20 meters before I got in and got pain meds. Tears was just pouring out BC of the pain. After the morphine, it all stopped except for the discomfort. CRP test was at around the 400s. Average cold gives about 9 and a healthy individual gives 3. Doc decides to do an ultrasound. Finds out there is stones in my gallbladder. A surgery later, and turns out my gallbladder was gangrenous and had started injuring surrounding tissue. Parts of the liver was necrotic and the abdominal wall. It all got removed. Doc said if I hadn't come in that day, I would most likely not be here today. Moral of the story: stand up for yourself and listen to your body. If you won't do it, then who will? If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.